Hello, my name is Adriana. I'm the nurse practitioner student. I will be assessing your cardiovascular and peripheral vascular system today. How are you feeling?
I feel fine.
Great. Patient is alert and oriented appropriately. Appearance is well kept, clean, and groomed, and no signs of acute distress. Patient will be laying supine in the bed with the head elevated at 30 degrees. Now I am inspecting the precordium for any visible impulses. I don't see any. I am inspecting the anterior chest wall. Anterior chest wall is symmetrical, no visible lesions or abnormalities noted. I'm going to have you turn your head to the left. I am inspecting for jugular vein pulsations. They are absent. Now I am palpating the precordium for any lifts, heaves, or thrills. No lifts, heaves, or thrills noted. Now I will palpate the apical pulse or PMI, which is located 5th intercostal space, mid-clavicular line. Pulse is palpable, no deviation noted. If there were deviations, it would be expected with pregnancy and those with a high left diaphragm. Now I will auscultate your heart sounds. I will use the diaphragm first, which is used for higher pitch sounds of S1 and S2, as well as to detect murmurs of aortic and mitral regurgitations and pericardial friction rubs. The aortic valve, which is the right upper sternum border at 2nd intercostal space. The pulmonic valve, which is at the left upper sternum border, 2nd intercostal space. Erb's point, which is left medial sternum border, 3rd intercostal space. Tricuspid valve, left sternum border, 4th intercostal space. And the mitral valve, which is at the apex of the heart, 5th intercostal space, mid-clavicular line. Now I will use the bell of the stethoscope, which is used for lower pitch sounds of S3 and S4, as well as to detect murmurs for mitral stenosis. Aortic valve, right upper sternum border, 2nd intercostal space. Pulmonic valve, left upper sternum border, 2nd intercostal space. Erb's point, left medial sternum border, 3rd intercostal space. Tricuspid valve, left sternum border, 4th intercostal space. And the mitral valve at the apex of the heart, 5th intercostal space, mid-clavicular line. Great. All of your heart sounds normal. Now I am going to palpate your arterial pulses, starting with your temporal arteries. Pulses are palpable, brisk, no thrill. I'm going to feel your carotid artery, so I'm going to have you turn your head to the left. And I'm going to come to the other side. I'm going to have you turn your head to the right. Pulses are palpable, brisk, no thrill. I'm going to check your brachial artery. Into the other side. Pulses are palpable, brisk, no thrill. Now I'm going to check your radial pulses. Pulses are palpable, brisk, no thrill. And check your femoral. Patient will be laying supine at this part of the assessment. Pulses are palpable, brisk, no thrill. Posterior tibial pulse. And check your other. Pulses are palpable, brisk, no thrill. Dorsalis pedis pulse. Pulses are palpable, brisk, no thrill. Now I'm checking for edema. As I palpate my thumbs into her legs and feet, I do not see any signs of indentation, which will show edema. So patient does not have edema in lower extremities. Now I will test for Allen's test. So I will have the patient clench her fists really tight while I firmly press on the ulnar and radial arteries. I will have patient open her hand. Hand is pale. I will release the ulnar artery. Hand is flushed within 3 to 5 seconds. I will have patient clench her fist again while I firmly press on the ulnar and radial arteries again. Open hand. And I will release the radial artery, and hand is flushed within 3 to 5 seconds. I'm going to go to the other side, have patient clench her fist really tight while I firmly press on the radial and ulnar arteries. Have patient open her hand. Hand is pale. I will release the ulnar artery, and hand is flushed within 3 to 5 seconds. I'm going to have patient clench her fist again. I will firmly press on the radial and ulnar artery again. Open hand. Hand is pale. I will release the radial artery, and hand is flushed within 3 to 5 seconds. So there is patency for the left and right ulnar and radial arteries. Now I am going to auscultate your temporal and carotid artery. I am using the bell of the stethoscope. No bruise here heard. Now I'm going to have the patient look to her right while I check the carotid artery. I'm going to have you hold your breath. Breathe. No bruise heard. Now I'm going to have the patient look to her left Hold your breath. No bruits are heard. Your assessment went well. If you feel like you need to come back and be seen, you can come back anytime. Thank you for allowing me to assess you.
Thank you.